Welcome back to Live at 9. It's Wellness Wednesday, and pollen season is tough for a lot of people, but for some folks, it can also be life-threatening. Today, we have Dr. Quinn to talk to us about the potential dangers of pollen. Good morning, Dr. Quinn.
Good morning.
So what conditions make pollen more dangerous for certain types of people?
Well, last week we talked about the general population and a high percentage of people having pollen allergies with the itchy eyes, the sore throat, the runny nose, and just feeling miserable. But today we're going to focus on people with lung disease such as asthma and COPD. This population is at an extreme higher risk of complications, to include exacerbations where they just can't breathe, increased risk of infections, and also possible hospitalizations, as I've seen, where they end up on a ventilator and they can lose their life. So this is a very important topic.
Wow, absolutely. And what are the dangers for people like this? What makes them even higher risk for things like pollen and allergies?
Well, see, when you're exposed to pollen, if you're allergic to pollen, you can have an immune response. And if you have asthma or COPD, you already have lung disease, which puts you at a much higher risk of having complications. As I said, an exacerbation where you can't breathe, increased risk of infection because of all the mucus in your lungs. And some of these people end up in the emergency room, ended up getting admitted, such as a lot of my patients have, and end up on a ventilator. And I've had a couple of patients over the last 20 years lose their life.
Wow. Well, Dr. Quinn, I mean, people that are listening, for those that are impacted by these types of lung diseases and asthma and COPD, how can they combat this? Because, I mean, like you talked about last week, a lot of people deal with the typical effects of this, but those that experience even worse effects, I mean, how do they combat this?
Well, the most important thing, and I talked to an asthma specialist, the most important thing they can do is make sure that they're up on their medications as far as their inhalers and just compliant. And if they haven't had their vaccinations for the flu and or COVID and RSV, get those vaccinations. And also the pneumococcal vaccination as well. And if they start feeling ill, go ahead and go visit your medical provider early. Don't wait, because if you get an infection and you have an exacerbation, that's what can lead to the hospital with the pneumonia, getting on that ventilator and, possibly losing your life. So you have to be very proactive and aggressive with your treatment regimen and be compliant.
Absolutely.
Like if you're on a certain treatment regimen, don't take a break. Take your medicine as prescribed. That is so important. And that's what the pulmonology colleague just really stressed to me to talk about to the general population of our viewing audience today. Don't not take your medication. And if you start having these symptoms, go get checked out. Don't hesitate. Go get checked out, because early intervention by a medical provider, such as steroids, oral and or inhaled, can really do a lot. And then in a lot of cases, we'll put the patient on prophylactic antibiotics, such as a macrolide, such as azithromycin, and this could really help this person and end up not going to the hospital.